Good afternoon. It's Friday the 10th of July 2020, just after 1 o'clock. Welcome to UK Column News. I'm your host, Mike Robinson. Joining me in the studio today, Patrick Henningsen from 21st Century Wire. Welcome to the programme, Patrick.
Great to be with you, Mike.
Okay, look, we are going to start with this, Patrick. Lots of people have been in touch with us over this. Guidance for public health officers, potentially infectious persons. It's not clear whether the government thinks that public health officers are potentially infectious or what, but we will see what this is about in a second. This comes under Schedule 21 of the Coronavirus Act 2020. Now, we did say when the Act was passed, if you were watching the UK column at the time, that this was an enabling act. And this guidance seems to give some clarification as to what it enables, published just a couple of days ago. So here we go. This is all about managing the spread of coronavirus, Patrick, and they're saying that the Coronavirus Act 2020 provides public health officers with powers to control the spread of coronavirus in the UK. Some of these powers existed already for England in the Health Protection Coronavirus Regulations 2020. However, the Act replaces these regulations with a consistent UK-wide approach and includes certain new powers for immigration officers and constables. They go on to say the relevant powers can only be used once the Secretary of State for Health and Social Care has issued a declaration, and such a declaration remains in force, that the incidence or transmission of coronavirus constitutes a serious or imminent threat to public health in England, and the measures set out in the Act are considered as an effective means of delaying or preventing further transmission of coronavirus in England. So it has to be stressed that these particular guidelines only apply to England, although just in the previous paragraph they were suggesting this was UK-wide. In fact, this particular document only applies to England. It does specify, though, that there are similar powers in place for the other parts of the UK, so there'll be similar guidelines in place. So the question is, what is a public health officer? Well, they give us a definition. A PHO is either an officer of the Secretary of State, e.g. in Employment of Public Health England, or a registered public health consultant, so designated by the Secretary of State. So it goes on to say, if you've received a letter from Public Health England acting on behalf of the Secretary of State, which confirms that you've been designated as a registered public health consultant for the purposes of Schedule 21, then you will fall within the definition of a PHO and thus be able to exercise the relevant powers. So this implies, Patrick, some kind of private sector involvement in this. It's not clear, but the term consultant tends to imply private sector. Sorry.
Yeah, it seems like they're giving license for public health consultants or public health officials to be acting in almost a police capacity, Mike. So law enforcement, as it were. So, and the sort of powers that under the Mental Health Act, for instance, under sectioning. So this really is a big step forward with this whole coronavirus emergency framework.
And isn't it interesting that they're taking this step at the time we're supposedly coming out of it? So this is clearly in preparation for the so-called second wave.
So-called second wave, the predicted second wave. We're not sure how they could be so sure that it's coming, but this comes at a time when a lot of the top, I think the report just came out, Mike. We might not have the details of this right now, but I think it just came out yesterday. The top 150 municipalities, local authorities in the country, top tier local authorities, pretty much COVID-free. Pretty much COVID-free. In terms of Devon, 8 infections or something like this. I'm not sure what it is, but you'll see similar numbers like this, or large geographical areas with just a handful of so-called cases. So, and like you said, now it's just disappearing, it's tailing off, and all of these new regulations and powers are coming in.
Now, the question in the chat box is what qualifications are needed to be a PHO. This is not defined. It goes on to say Schedule 21 Parts 1 and 2 also include powers for constables and immigration officers to support the function of PHOs. So PHOs aren't supporting the functions of constables and immigration officers, quite the opposite. So this we'll explain why that's necessary in 1 second. It says a person is potentially infectious if the person is or may be infected or contaminated with coronavirus, and there is a risk that the person might infect or contaminate others. So you don't have to have had a positive test. It's only if there is doubt there. It's if you may be infectious, and the person has been in an affected area within the 14 days preceding that time. Sorry, that's an or, not an and. Now, just to define what an infected area is, that refers to any country, territory, or any other area outside the UK that the Secretary of State has declared for this purpose in a notice on gov.uk. Now, we'll be coming on to the countries outside the UK that the Secretary of State seems to have already declared
That's right.
Are problematic. But this is really key. So this is about internal to the UK and also people coming into the UK. It goes on to say this, 3.7, implementation of your powers will be done at a local level, coordinating with local resilience partners in accordance with local arrangements. So this is not being handled at a national level. This is being handled at a local level. Your local authority is in charge. Of course, local resilience partners said, well, these partnerships have been being established for a very long time now. They're well established. The UK column has been talking about them for a number of years. Of particular concern are the multi-agency public protection arrangements that we've been talking about for a long time. It goes on to say this, if a person is not willing to comply voluntarily with any instructions, a PHO should first have a conversation. If the person is still not compliant, then you should invoke the powers conferred on you by the Act. It says 3.9e, where will the person be taken for screening and assessment? This facility must be suitable for screening and assessment. This could be an isolation facility, an NHS facility, or any other agreed facility as long as it's suitable for screening and assessment. So you'll be taken off somewhere, sometimes with the help of the police, sometimes perhaps with the help of an immigration officer, but that's not necessarily the case in every instance. And it also applies to children. So 6.2, you may only exercise your powers on a child in the presence of A, an individual who has responsibility for the child, or B, if no such adult is present, an adult that you consider to be appropriate, having regard to the views of the child. This is quite unbelievably concerning, and people should be asking many questions about this. So a PHO can come along and remove a child with an adult that they consider to be appropriate.
All based on whether there's a suspicion that you might be infected or that you may have been in an infected, quote, area in the last 14 days.
Absolutely.
So maybe, if, might, possibly.
Possibly,
we don't know.
Perhaps. Absolutely. It goes on to say this. Individuals should always be given the opportunity to comply voluntarily with public health advice. So it is purely voluntary, except where it isn't, because it then says it is only at the stage where individuals do not comply with such advice that we would look to impose measures under Schedule 21, Parts 1 and 2. So this is absolutely mandatory. There's no choice in this, but don't worry, you'll be given the choice. You'll be given the opportunity to make the right choice before they haul you off against your will.
Is that not classic doublespeak right there, 9.1 and 9.2? There's nothing voluntary about that. They're saying voluntary in the first clause, and in the second they're saying no, actually no, it's not voluntary. We're only giving you a chance to volunteer yourself. That's not voluntary.
Yeah, don't worry, Patrick, we live in a democracy, except we don't. Right. I mean, that's absolutely clear there. And just to summarize this from another part of the document, public health officers may direct, remove, or request a constable to remove an individual to a place suitable for screening and assessment. That is the situation. Now, when the legislation was originally enacted and published, we did highlight this at the time, but these guidelines make it somewhat clearer because, of course, the legislation is in a particular, it's in legalese. It's not necessarily the easiest thing to do to interpret it. And in fact, to interpret it, you've got to understand a whole bunch of other legislation as well. This makes it absolutely clear in black and white. So what does Simon Dolan have to say about this, Patrick?
Well, he made a comment on this. This is on Twitter. He says, take a read through this document and you'll see why I'm fighting so hard in his legal challenge against the government on behalf of many businesses across the country. These regulations, give the right to take away from home and detain anyone, including children, for up to 14 days, using force if necessary, if they suspect you might be infected. England 2020, says Simon Dolan. And just a reminder here, this is his legal challenge, Mike, that he's running. You can see this up on Crowd Justice. Join the legal challenge to challenge the UK government regarding lockdown. And he has run into a slight wall recently, but he has just announced on his crowdfunding page that they're challenging the government's decision to deny permission for a judicial review over the government measure. So he's really taking the fight now to the government. This is not an easy fight. Obviously, you're going up against a massive machine here in terms of legalese and the judiciary, but the fight is being waged nonetheless. So go to Crowd Justice to learn more about Simon Dolan's legal challenge against the government.
Absolutely. Now, of course, this guidance is published just in time for the borders to be reopened. We can now travel to and from certain countries without quarantine. Patrick, so what is the situation with this?
Well, we sort of know, but we don't know. There's a little confusion involved here. So arrivals to the UK from dozens of countries will no longer have to self-isolate. So no mandatory quarantine if you're arriving from a number of countries. Priti Patel, the Home Secretary, announced this back in June, that there would be a quarantine 14 days for anybody coming from outside of the UK. Now they've green-lighted, basically. They're calling it a air bridge, if you will, or immunity bridge. But there's just a little bit of confusion. Look who's back. Doesn't know quite what to do about booking his holiday. That is Caroni, ladies and gentlemen. And once again, as always, he's a bit confused. And just to add to the confusion, all of these safe countries, Mike, are pretty much uniform across England, Wales, and Northern Ireland. However, there's a problem. Scotland, it's not uniform. Nippy wants to keep restrictions on Spain. Anybody coming from Spain is not safe going to Scotland. So if you're coming from Spain or you're a Spaniard, you're going to have to be quarantined if you want to fly in north of the border. So
well, this is an interesting point, because she also warned anybody in Scotland that was heading off to Spain, for example, that they shouldn't even consider trying to travel through an English airport, because, well, she didn't specify what might happen to them, but she just said don't do it.
Yeah, or don't fly into an English airport and then drive over the border to Scotland.
Exactly. That was the clear problem with that.
There's another workaround there. Yeah. So I don't see how she's going to be able to enforce that one for anybody that really wants to go to Spain. But so Caroni's confused, and he's not alone. And let's call this biojingoism, because this is interesting. Just considering Brexit and to the Remainers anyway, in the spirit of a united Europe, between 40 and 54% of Spaniards would disapprove of tourists from a group of European nations. The figure rises to 61% for those coming from the UK. So the Spanish aren't particularly keen, Mike, apparently. 6 out of 10 don't want people from the UK coming to Spain. Why would that be? Maybe because of the astronomical COVID numbers in the UK. Now, opposition to UK holidaymakers is not confined to Spain, however. 58% from Germany and 55% from France. 44% from Italy have similar sentiments.
Interesting that Italy is only 44%.
Yeah, for Brits abroad. So Italy, on the whole, the majority have fealty towards the British public regarding the corona crisis. But so a little bit of ambivalence there from Germany and France. So that's interesting, isn't it?
Yeah.
I thought we were all one big happy family. Maybe this is the Brexit effect.
It could be.
Who knows? But let's take a look at the total number of safe countries here, Mike. Australia, I might add, on that list, Victoria's gone into lockdown again.
Yeah.
So Hong Kong is also on this list, which is interesting. Not China. We'll look at some of the unsafe countries in a minute. But this is just a rundown here of the countries that are declared safe by the UK government. So
including Vietnam. I mean, there's some perhaps surprising countries on that list.
There are. It's a very interesting list. Pretty much most of the British Commonwealth, not a lot of the large countries. But let's look at who's not safe. This is where it gets very interesting, especially considering the previous segment that you covered, Mike. Sweden is not deemed safe.
Sorry, Sweden's not safe despite having a lower death count per million than the UK, and the fact that it's recovering better than the UK at the moment. Sweden's not safe. dare I suggest, Patrick, because they won't wear masks?
This is part of it. Sweden did not go into full lockdown from the beginning of this crisis, and the UK press has been punishing them. There's been a smear campaign internationally from lockdown countries against Sweden. So that might be part of it. So in a way, this is kind of retribution. That we disapprove of how Sweden has managed the coronavirus crisis. Therefore, we're going to reimpose sanctions on Sweden for travelers, make life a little bit more difficult if you think you want to go visit Stockholm or Gothenburg or go up into the Swedish highlands for the weekend. So let's look at who else is on the list here. Serbia is on the disfavored list. They were okay, Mike, until a couple of days ago, and something happened a couple of days ago that put them on the bad list from the UK government. Well, I'll show you that in a second, but that's interesting. Of course, Bulgaria, the people rose up and ended the lockdown last month or the month before, 6 weeks ago. So that they're being punished a little bit. There's absolutely nothing going on for COVID in Bulgaria, Mike, non-existent. But the people rebelled against lockdown. So I guess they're on the bad list. Albania, same thing. The people rose up. They basically ended the lockdown and scared the government, who thought they were going to lose power for a minute there. So they're not allowed any sort of special safe status by the UK government. And of course, China, Hong Kong's on the list, but China's not. Figure that one out. There is travel between Hong Kong and China, free travel and so forth. So China's being punished. And of course, the United States is not on that list either for maybe obvious reasons. It's now the sort of lead country in terms of the whole COVID crisis. But Russia's not on the list either. They're not safe. Neither is Belarus, a non-lockdown country. So what I'm saying here, Mike, is there's a geopolitical shape to this. And it'll be very easy now using these various restrictions, the PHO document we saw, plus travel, red tape, to basically draw borders, Mike, invisible borders around the world. And most of the NATO countries are fine. They're all safe within the NATO bloc for the most part. So there could be a geopolitical dimension to this. So let's look at what happened in Serbia. Why did Serbia all of a sudden fall out of favor in the last 48 hours? Well, maybe it was this. Tens of thousands of people outside of the government, the parliament building in Belgrade, protesting new COVID-19 lockdown policies by the government. So they had something like 300 new, quote, infections, and 15 people supposedly died from COVID in the last week or so. And all of a sudden the government puts a new lockdown order on the public, and then tens of thousands of people come out in droves to protest this, and all of a sudden they're on the bad list in terms of the UK government. So isn't that interesting?
Yes.
This is totally arbitrary how they're drawing up these lists of what countries are safe, what countries aren't.
What about Belarus and Russia?
Belarus and Russia are not safe, deemed safe. So again, there's a geopolitical dimension to that potentially. But I don't know what this situation is in Russia compared to other countries. They seem to have similar numbers in general. I mean, in terms of Sweden, Belarus, Bulgaria, a lot of these countries, statistically the differences are very minor, insignificant in fact, if you're talking about countries of 3, 5, 7, 12 million. And you're talking about numbers in terms of fatalities within a difference of hundreds or maybe 1,000 or 1,500 since March. It's a non-event. It's neither here nor there. So how can you discriminate from one country to the next? I'm calling this bio-jingoism, potentially. There could be a geopolitical element to this. This could be used to restrict travel around the world, drawing invisible borders, using the COVID-19 crisis to do that.
Okay, now let's bring this website on screen. This is the IMHE. This is the Institute for the Institute for Health Metrics and Evaluation. It's an independent, or they call themselves an independent global health research center. It's based at the University of Washington in Seattle, and they produce models just like the Neil Ferguson model at Imperial College. So they produce some new models for what happens depending on whether we wear masks or not. So let's have a look at that. Here we go. 68,367 COVID-19 deaths in the UK is what they're predicting. But as you can see, if you look at the graph there, the dotted red line to the right-hand side is what happens if the UK doesn't wear masks, and the dotted green line is what happens if the UK does wear masks according to their models. So they're saying that 68,000 COVID deaths by November in the UK, or if we choose to wear masks, that would be 48,000 deaths if we wear masks. The same goes for, let's see, what's this one? Daily deaths. As you can see, if we don't wear masks, the daily death rate is going to go exponential again. But if we do wear masks, then the daily death rate is going to collapse. It's fantastic stuff. And here we go. This one is daily infections and testing. And as you can see, once again, if we don't wear masks, daily infections and testing are going to go exponential. If we do wear masks, then they're not. So the question is, are their models accurate? Well, not really, but we'll come on to that in a second. Let's just remember what we said last week about masks. This is the warning on a package of masks. This product is an ear loop mask. This product is not a respirator and will not provide any protection against COVID-19 or other viruses or contaminants. Wearing an ear loop mask does not reduce the risk of contracting any disease or infection. User is solely responsible for the selection of appropriate personal protection equipment for the setting and application. Change immediately if contaminated. Now, of course, if you remember last week when we were talking about this, there was a whole fact-checking exercise over this, and the conclusion from the fact-checkers was that although this warning on the box was correct, it was being misinterpreted by the people who were suggesting that this meant that masks don't work. I'm not quite clear how that could possibly be misinterpreted, but there you go. Now, getting back to this organization, the Institute for Health Metrics and Evaluation, the question is, are their models accurate? Well, absolutely not. This is Vox reporting that this coronavirus model keeps being wrong. Why are we still listening to it? And of course, just like the UK government listened to Neil Ferguson at Imperial College, the US government was listening to the IHME and Chris Murray, and it was just about as successful over there as Neil Ferguson was over here.
So I have to ask a quick question, Mike. If these models are correct, how come countries that don't have mandatory masks haven't had them for the duration of this crisis? How come they're not seeing these spikes that are being predicted in all of these different models?
Well, I don't have an answer for you, but what we do know is that those countries then end up on the bad boy list, as you've just defined.
On the red list.
Absolutely.
Yeah, unsafe countries.
Absolutely.
Unclean.
Absolutely. And just a quick reminder is if anybody watching this program needed any reminding, here's Cato Institute, how one model simulated 2.2 million US deaths from COVID-19. This, of course, was Neil Ferguson's model, and the mainstream press couldn't really ignore it here either. Could be the most devastating software mistake of all time. Yes, indeed.
So we should have learned the lesson regarding computer models months ago, but yet here they come, new models. New models.
This time the latest propaganda is over masks. Now, I'm just going to remind everybody, here's just 3 scientific papers on the use of masks. Now remember, N95 respirators, these are the most the most significant type of masks that anybody can use.
The gold standard.
Absolutely,
as
the gold
far
standard.
as pedestrian masks go.
Absolutely. So, and this report, this scientific paper here, saying that the use of N95 respirators compared with surgical masks is not associated with a lower risk of laboratory-confirmed influenza. Now, we're not talking about influenza here; we're talking about COVID. But the sentiment is the same. The same thing applies. This one, preliminary report on surgical mask-induced deoxygenation during major surgery, and showing that, in fact, heart rates rose as a result of the lack of oxygen. Now, we have seen a little video clip doing the rounds of social media. I think it's a very useful video clip of a guy who tests air quality in commercial settings, testing what happens whenever you put a mask on. And he's making the point that in the United States, the legal limit for percentage oxygen in the air is 19% if you're working in a commercial setting. And that immediately he puts a mask on, the amount of proportion of oxygen available is 17%, and the alarm goes off on his calibrated test equipment. So this is an extremely important situation, the fact that you lose oxygen supply. And then finally, a third paper here, mechanisms for, well, we're not going to read the title of this. Basically, the headline, the key point about this paper is showing that the hypoxia induced by mask wearing has the potential to cause tumors. This is
And hypoxia is when you breathe in your own carbon dioxide, right?
Well, no, hypoxia, no, that's another thing. Hypoxia is when you simply have a lower level of oxygenation in your bloodstream, and it's extremely dangerous. And as you say, breathing in your own carbon dioxide, also extremely dangerous. And in fact, the excess carbon dioxide in your bloodstream can cause enhanced mental health problems. It can cause all kinds of issues. So,
well, knowing all that, it just makes perfect sense that people should wear masks outdoors all day, maybe 7 to 8 hours a day, right? Knowing all those things that you just said, all of those drawbacks to wearing masks.
Absolutely.
Makes perfect sense.
Perfect sense. Perfect sense. And here's something else that makes perfect sense. We reported this on earlier in the week. This is the Irish News with a leaked health service action plan for Northern Ireland, which reveals that the 5 largest hospitals in Northern Ireland were no longer going to, or are no longer going to accept walk-ins to accident and emergency by August. So you will not be able to just turn up at A&E and expect to get some support. The only way to get into A&E will be to go by ambulance. Now, they were claiming that they were going to create other centres, emergency centres for other things, whether you've broken a wrist or need an x-ray or whatever it is. But nonetheless, this is a significant change in policy. Well, it looks like there's a similar, not quite the same, but a similar change in policy coming to the rest of the UK, and that is in the form of appointments. So you're going to have to know when you're going to break your wrist or your elbow or your shoulder, Patrick, and make sure you make an appointment at A&E before you do it.
So it's a telephone interview. It'll be a telephone screening.
Absolutely.
So telephone triaging for A&E. They've already instituted this with GPs, right?
Yes.
They have. Okay, so now if you do this with A&E, you're more or less going to get the same sort of experience, aren't you, with a screen phone call that you do with your GP? In other words, they're going to be trying to filter out as many people as possible to keep them away from A&E treatment, right? Because
this is the case.
They're already being kept away from their GPs, so now they're going to be kept away from A&E.
So one of the reasons that so many people died in their homes during the lockdown was that they were scared to go to hospital. So the psychological operation had meant that they were not willing to go to hospital through fear, and as a result, people were dying of heart attacks and strokes. Now there's going to be a triage situation. So the fear isn't sufficient to keep enough people away, it seems. And this, again, is on the basis of a perception that there might be a second wave coming. Now, I think that there is going to be a perception of a second wave coming, because that's going to be something which is given to people through the mainstream press, a perception. It's not going to be a genuine event.
So as we reported before, Mike, effectively GPs are more or less shut down for normal service. Now A&E shut down for normal service. So the NHS, a large portion of the NHS is effectively shut down.
Correct.
I thought we were rebuilding the NHS. I thought we needed to save the NHS. It was a national treasure. It's providing this great service for everybody. So why is so much of it being shut down right now? I have an idea. If you can't get service through the NHS, wouldn't this open up an opportunity for private healthcare to sort of open and offer alternative services for money?
That's absolutely one possibility. The other possibility, of course, is that if they simply through the shutdown of the NHS drop people off waiting lists, then all kinds of statistics can be massaged to make the NHS look even better.
It's going to create a market for private healthcare.
Yeah.
And if you have a choice between getting treatment that you need and not getting it through the NHS, more than likely, what are you going to do? You're going to pay for it.
Well, a lot of people aren't going to be in a position to do that, as we're just about to come on to. But let's just say thank you very much once again to everybody that has helped Ian Crane with his GoFundMe campaign. That's now up to £29,450 just before we came on air. It'd be lovely to see that over 30,000 in the next day or so.
Yeah, and mind you, they met their goal very early, and it's really a big thank you to everybody who got in and contributed to this. This gives Ian great amount of liberty, if you will, in terms of his own treatment, and for anybody going through this type of situation, and many of us do have loved ones who've been through the situation, having that ability is a big, big thing. It makes a huge difference. So thank you to everybody who jumped in and helped out on this effort.
Absolutely. Now, on Wednesday, Rishi Sunak, the Chancellor of the Exchequer, gave a budget, a sort of mini budget. We were just, we'll just remind everybody, this was from a couple of weeks ago. He was in, when lockdown was shops were starting to reopen, he was in looking at the books, and he clearly got his inspiration for the mini budget from the books he was looking at, which was, as you can see there, Patrick, Enid Blyton mainly.
Heady stuff.
Heady stuff, absolutely. But one of the things that he announced, Patrick, was the fantastic deal over pub grub.
Yes, this is going to put a lot of people's minds at rest to know the Chancellor has okayed what they called, it's funny how they rolled this out, 50% off a meal out. So in order to kickstart the economy, the Chancellor is giving vouchers. Supposedly it was 50% off a meal, but that really wasn't what it was.
No, because when he announced this, I sort of thought, well, a couple of people go out for a meal, they're going to spend 100 quid. That's a pretty good deal.
Yeah, no, it's not. It's a £10 voucher for some pub grub, and we managed to get a hold of one of these vouchers. Here we go. This is a £10 voucher here. Stay alert, control the virus, and if you're willing to pay the upgrade fee, Rishi himself will come and serve you at your table, Mike. How exciting could that be?
But my understanding was he served the wrong table, so you may not get that deal.
He did. I think he was doing a little shift at Wagamama's here and sort of mixed the orders up. But he's got a big smile on his face, and he's rolling up his sleeves. That's what's important. Tony Blair showed us how to do that.
Yeah, absolutely.
Back in the day, roll the sleeves up and get stuck in. So, but what this is a kind of, Mike, here's another image here of somebody with a mask on. I don't know if they're a punter or staff or whatever, but the hospitality trade has been wiped out effectively, especially independent-owned businesses. They've really been wiped out. They may not survive all of the excessive regulations and so forth, but effectively the government is saying, we'll give you a 10 quid voucher for a pub meal, but you're gonna have to pay for it in tax hikes and austerity for the next decade. Well, I mean, it's unbelievable that they would try a stunt like this, and somehow that's going to ingratiate the public in some way. It's amazing.
Absolutely. Now, this is how the BBC presented that on Wednesday afternoon. Chancellor gives diners 50% off on eating out, and so you immediately think, yes, this is going to be really nice. And then the image they put beside that is 4 people sitting around a table with 2 glasses of wine between the 4 of them and masks on everybody. It's not clear how anybody's eating anything or drinking anything under those circumstances.
And look at the boy in the foreground with the beard here and the Lenin porch climber cap. He's got his hands on a glass of Merlot and he's still got his mask on. How is he going to negotiate that, Mike? How's he going to drink that glass of wine? That's the question. So this is a propaganda picture.
Total.
That's been put here, and we see so much of this in the mainstream media. Of course, The Guardian has, they're effectively functioning as a propaganda vehicle for the state with very similar images in a lot of their sort of COVID coverage.
Absolutely. Now, we had a message in just before the program, and I'm just going to read a little bit of this because it is relevant. It's from somebody. Thank you very much for this. He says, I work as a chef in the UK and thought you might be interested to hear how the lockdown has affected him, his colleagues, and overall hospitality. So, abnormal measures, one-way system for staff and guests, visors worn by front of house, have been asked to wear a mask if in front of guests. Seating is all socially distanced. Delivery drivers can't go inside the premises. Some staff have been taken off furlough, others not. They have to keep their distance in the kitchen, which is impossible. They're not able to sit next to each other when having a break, which is the only time of the day they have to chat amongst each other, interact and communicate freely. He said that his employers can't afford to take everyone back, so they have an A team and a B team. The A team is back working now, and the B team are ready to come off the bench as and when they're needed. So of course this is creating jealousy and division within the staff of the restaurant. So we're seeing this type of tactic everywhere. Now I understand that restaurants can't necessarily, well, I mean, they simply can't afford to bring everybody off furlough straight away, because these restrictions on what they're allowed to do are so draconian that they cannot go back to the staffing levels they had before, because they simply can't afford it. Now, I don't know if you've got any thoughts on this, Patrick, but I think there are one or two outlets that are starting to appreciate this and are starting to pretty much ignore.
So more and more, the furlough scheme by the government is becoming more and more a cheap facade for really an expensive unemployment scheme, really prolonging the inevitable, right, in terms of layoffs.
Well, that's right. And of course, it only lasts until October. So after that, we're going to see the significant layoffs. There were last week 9.1 million people on furlough. And last week we heard the announcement that 300,000 people had come off furlough. Now, I'm not, haven't seen the latest statistics for this week. It's not going to be significantly more than that. So, you know, we are still looking at a significant number of unemployed, and we'll be coming onto that in a second.
And the European countries that don't have all these restrictions and regulations and one-way systems and visors and A teams and B teams, they're not having any second waves or spikes. Why is that, Mike? Caroni is not spending time on the continent anymore. He's only in the UK, apparently.
So it seems.
I don't know.
Now, one of the other things that Rishi announced was this, but we're going to leave it to Therese Coffey, the Department for Work and Pensions Minister, to tell us all about it. She said, as we finally enjoy the long overdue haircut, go to the pub and pop out for a meal, we're finding our new normal. Well, we do understand what that means.
I think her haircut's long overdue as well, Mike.
I couldn't possibly comment. But anyway, she goes on to say this, that she's bringing in 13,500 new work coaches dedicated to helping people find work and have a huge impact. And that's going to have a huge impact. So they're bringing 13,500 work coaches into Job Centre Plus to help the 8 million people that are going to be unemployed find new jobs. Can you tell me how that's going to work? Because I don't have a clue. She went on to say work coaches are the people who can see from a CV that someone can pivot from one struggling sector into another thriving one.
Wow, the ability to pivot on the fly. I think they could probably all get jobs as contact tracers. That seems like a pretty cushy gig.
Yeah, well, there are some jobs. There aren't 8 million of them, but
COVID cops inspecting pubs, making sure people are social distancing and staff members are not taking breaks together and talking to each other. Things like that.
Absolutely.
We need to crack down on that.
Absolutely. Now, of course, Rishi has announced on Wednesday this £2 billion kickstart scheme, which includes the bung for going to the restaurants. It also includes some money for removing stamp duty from properties up to £500,000 and a £3 billion green fund on top of that. So that's vouchers of up to £5,000 for energy saving home improvements, new insulation and stuff like this. It's lots of vouchers being published at the moment.
Why can't they throw in a pint with the half-price meal deal? I don't understand.
No, they're not paying for the alcohol industry. That would be considered
glass of house wine or a pint.
1.6 billion package of loans and grants for the arts and heritage sector announced as well. So where does that take us? Well, let's have a look at the overall debt situation. So government debt now up to £2 trillion or so. None of these other areas of debt have really shrunk since 2008. In fact, they're probably worse in most cases. But that brings us around the 16 trillion mark for the total outstanding debt for the country as a whole, between government, private, personal, pensions, obligations, and so on. And at the bottom, you see, I've had to put a question mark beside the percentage of GDP because, of course, we don't know what GDP is going to be this year. It's going to be a fraction of what it was. And so this actually doesn't represent 800% of GDP, which is where it was before Caroni came to visit. It's probably going to be significantly higher than the 800% of GDP. But it is a question mark because we simply can't tell.
That's scary, Mike. This is getting into IMF rescue loan territory in terms of third world countries. in terms of debt to GDP ratio. It's crazy.
Absolutely. But don't worry, because more and more information is coming out about the scale of the problem. The OECD this time facing the jobs crisis. So that's fantastic. They're telling us that the pandemic has triggered one of the worst jobs crises since the Great Depression. I would suggest it's probably worse than that. But anyway, what have they been saying? Well, let's have a brief look. The impact is 10 times worse in some countries, though. So people's working hours have plummeted. And as you can see, the blue line on the screen there at the moment is the 2007-2008 financial crisis, the financial crisis to end all financial crises except for the next one. And the red line shows the COVID-19 crisis. This is the number of hours worked. Well, of course, that's as a result of lockdown. That isn't going to come back very, very quickly. But let's look and see what happens with unemployment. And they say that on the basis that there's a single hit scenario, so that what we've had is all we're going to get, then the UK comes down below France, the Euro area as a whole, Canada and the OECD countries, and we will have 3.9% unemployment as a result of what's already happened. But should there be a second wave, Patrick, the situation gets a lot worse because we jump up to second place, one behind the United States at 14.8% unemployment. And the thing equally of concern, though, is that this is unemployment levels for Q4 2020. If we, sorry, you're going to...
Well, I just want to point out, Mike, that the numbers you're looking at, it's important for people to realize coronavirus is not driving those numbers. What's driving those numbers are government lockdown policies.
Absolutely.
That's what drives those figures.
Absolutely, absolutely. But those are for Q4 2020. So let's move ahead a year for what they foresee in Q4 2021. And as you can see, the United Kingdom in a year's time will still be at 9% unemployed. That is a pretty spectacular situation.
I think that's usually underestimated, but that's what government does with unemployment figures generally.
I completely agree with you, yeah. but my point here is that 13,500 work coaches isn't going to cut it under those circumstances. Frankly, the Job Centre Plus isn't going to cut it either. They're not going to cope with the numbers of people that are going to be attempting to get support. So what are they going to do? Provide telephone support? No.
Training schemes, I don't know. They have to make work. Isn't that what the job coaching is, Mike? 13? Did you say 13,000?
No. Job coaching will involve totally giving advice, looking at your CV, and looking at what other industry sectors you might look for jobs. But if the jobs aren't there,
and those are new jobs, those job coaching jobs, right?
Oh, they are, yeah.
So those are the only jobs, I guess. It should apply to be a job coach.
Absolutely.
That's where the money is. That's where the work is.
Totally.
There are no other jobs growing in any other sector except security and COVID regulatory inspectors. That's it. Or job coaching.
Absolutely. Yeah. Now, in terms of government money being spent, Patrick, then, what's happening with your universal credit?
Well, as we've said on this show many times, UBI, Universal Basic Income, or Universal Credit, has been an absolute nightmare. But the nightmare doesn't end only with the person's compliance that needs to collect the money and how difficult that can be. The cost of rolling out Universal Credit is rising by another £1.4 billion.
That's just the cost of actually administrating the whole thing?
Rolling the program out. So that doesn't even begin to touch on the problems with this in general. In terms of people keeping up with their basic costs of living, the system doesn't work, or it's not very effective. And in many cases, Mike, it leaves people further in the hole than they were before by the time they go through this process. So this doesn't work. This system doesn't work, but yet the government is still getting behind it, still pushing it forward, even though it's not working. So this is not good times. So.
Right, now a bit of interesting news here, because on Wednesday's program we were talking about China and the new dossier with respect to Huawei and China, written by Christopher Steele. And in fact, his dossier was all about the people in the UK being influenced by China, very Russiagate in its formulation. But Patrick, he's not having it all his own way.
Well, he's not, Mike. And a British private intelligence firm, Orbis, this is Orbis's top fantasy fiction writer, has been ordered by a British court to basically pay Russian bankers. So writing defamatory or libelous material, he's now been ordered to pay out to the Russians for making stuff up, basically.
But to clarify that he's not paying this out to the Putin regime, he's paying this out to oligarchs, is that right?
To private citizens,
Right.
yes, who've been named and shamed or mentioned in some way, shape, or form. So, and again, while everybody's still putting all this credence into the Russian narrative, going into the next U.S. election cycle, which is going to be in 4 months, is going to be an election, they're still now revitalizing, reharping on the Russian narrative, and you have things like this happening in court. So Christopher Steele's reputation continues to plummet, but yet I'll bet, Mike, he's not short of work still.
Indeed, indeed. So where does that take us?
Well, it's time for a feel-good story. It's not all bad news, Mike. It's not all bad news. We wanted to kind of close the program out with a feel-good story, and this is Rocky, and this is where the White Helmets meet Rocky. They're saying, and Rocky, this is effectively Al-Qaeda pet rescue. And we do notice that someone has tied the dog up to the tree, it looks like, anyway. And we fear for Rocky's safety, but he's in good hands, apparently, and the White Helmets can now wear their COVID mask with confidence. This is in the Idlib province. This is the last remaining terrorist stronghold in Syria. They've been flushed out of every other part of the country, but they still remain in Idlib province. So this is Al-Qaeda pet rescue, but it gets better than this. Let's look at this is the White Helmets account. Let's look at this story. This is wonderful. This is posted by the White Helmets yesterday. They're carrying out here an aqua rescue, Mike, believe it or not. This is on July 8th. Hussein Al-Sagur, a 12-year-old displaced from Homs, our White Helmets water rescue team. You can see the 3 water rescue specialists there up on deck in their boots and helmets. They've recovered his body. Apparently he drowned in one of the swimming pools in the Idlib countryside. Let's take a closer look at this, though. And what do we see? Well, firstly, we can see this the clothesline there, drying the clothes. So this looks like it could be a former public swimming pool, perhaps. It's been commandeered. There's some Quranic verses on the back wall there. But this is interesting. This is a scuba diver in the pool. So the White Helmets needed a scuba diver to get this body out of the pool. So what is this? This is Baywatch Idlib. What else can we call it? This is, you can't get better comedy than this, Mike. I don't know.
They seem to be getting more desperate with the levels of their propaganda.
Yeah, their support is absolutely plummeting, and so nobody really cares anymore. The media have abandoned Syria. The money's drying up from all the governments, and they're still putting out all these sort of pap stories on their Twitter feed, and they're just getting more and more ridiculous by the day. So
Absolutely.
if you want a good laugh and be entertained, follow the White Helmets on Twitter. There's a plug.
Absolutely. Okay, well, we will leave it there for today. Thank you very much for joining me today, Patrick. Thank you for joining us. We will be back at the same time on Monday as usual. Have a great weekend, and we hope to see you then. Bye-bye.